Today, we have a blood film that looks like this. The red cells look like they have bites taken out of them. In hematology, we call these cells bite cells. Remember I told you we weren't an imaginative people? Work with me here. There also looks to be slightly more of these purplish, slightly larger red cells than usual. These cells are polychromatic erythrocytes or reticulocytes. Remember from the RBC video that these are immature red blood cells. There is always a small amount on any patient slide, but an increase indicates that the body is producing more red cells than usual. Bite cells are usually a sign of oxidative hemolysis. So when I see them, I know a trip to the patient's history is in order. What I'm looking for is a mention of a deficiency in the enzyme glucose-6-phosphate dehydrogenase, usually called G6PD, or the use of certain medications. So G6PD is needed to maintain adequate levels of glutathione, an essential buffer for reducing cellular oxidants. In G6PD deficiency, this pathway is impaired and cellular oxidants accumulate, which leads to red cell injury. When certain medications are used, this pathway can also be overloaded in patients without G6PD deficiency and also cause red cell injury. These medications are dapsone and I'm not even going to try to pronounce these names, people, so just read the list on the screen. To clarify, when we talk about oxidants, oxidative hemolysis, and oxidant injury, we are not talking about the breathing oxygen, but more along the lines of Leo the Lion said GER, or loss of electron is oxidization and gain of electron is reduction. So what is this red cell injury I keep mentioning? Well, these oxidants cause oxidization of hemoglobin and other cellular proteins, which form disulfide bridges. This oxidized hemoglobin precipitates as Heinz bodies. These Heinz bodies can be seen when a supravital staining technique is used. When these cells pass through the spleen removes the precipitated hemoglobin, causing bite cells to be formed. If the membrane is long enough to reattach, blister cells will occur. Thus, bites and blister cells are signs of oxidative hemolysis. Now you know. But to continue you on your hematology journey, check out this video on the screen now. Thank you for watching. Until next time.